For patients with missing teeth who need additional bone support for placement of dental implants, typically bone grafting must be performed. Here's how we at Live Oak Oral Surgery use the latest technology to prepare for bone grafting for dental implant placement. In the simplest way, bone grafting for dental implants is just the replacement of bone that may have been lost from the patient's jawbone in different manners. There are a lot of different ways that bone can be lost in the jawbone. It can be lost due to infection. It can be lost due to trauma. It can even be lost due to the extraction when the tooth was removed. Bone grafting is the process by which bone tissue is placed as a placeholder in the mouth for where we want to place dental implants. In the modern medical landscape, this is a safe, painless, and routine process. At Live Oak Oral Surgery, we have literally placed thousands of bone grafts for dental implant patients. In each case, we have to determine how much bone is there to support the dental implant. The dental implant in its simplest form is just a titanium screw that we place into the bone. If you look at any other kind of screw, you have to have a very large amount of substrate to make sure that they are secure when they're placed in it. And it's the very same with dental implants. At Live Oak Oral Surgery, we have incorporated the use of cone beam CT imaging, which allows us to look in 3 dimensions at each individual patient's jawbone structure. This will tell us whether there's adequate volume for us to place a dental implant or not. Definitely making sure that we are avoiding any of the vital structures such as the sinus and also the nerves that run inside of the jaw. If you have been recommended for dental implants and you feel that that is the treatment for you, call us so that we can get you on the right path.